Arkansas Children's Hospital has had a diabetes program since endocrinology began many years ago, but we revamped that clinic in 2015. The diabetes program today looks like a much more robust program than it had been in the past. We're seeing more kids in the hospital as new patients to us, and we're seeing more patients flow through our education program and through our clinics.
This institution is very nimble and very effective at handling challenges and pivoting when something needs to be done a different way. That's not always true at larger institutions where the wheels move very slowly. And I have done clinical research in both of those environments. And I can say that I actually prefer doing research here where we can meet those challenges very, very quickly, and people are very adaptable. We're really very fortunate here at Arkansas Children's to have a unit that's dedicated solely to research called the Pediatric Clinical Research Unit, or PCRU, here in the main hospital. It's a very robust, highly functional unit. It's a real joy to work with the folks there. Because it's such a great unit, we've been able to enroll very well in both of our research studies. We currently have 2 studies in oral medications for children with type 2 diabetes, which is a critical need.
My clinical experience here has been really, really great. I trained in New York, so coming here and to a different state where we are the only hospital in the state and seeing all kinds of patients, it's been very, very unique and a very nice clinical experience, and we are able to provide excellent care to everyone in the state.
I think one of the things that makes our program unique is that we have a very family-centered group. We have a very close-knit group, and we know our community very well. So we're able to address the education concerns that families have on an almost one-to-one basis.
Our team at Arkansas Children's Hospital is fully committed to education and outreach within our diabetes program. When a family is diagnosed with diabetes, they are brought into the hospital for 2 days of education. We call these our survival skills, and they learn the foundations of making it safe to take their child back home. And then within a few weeks, we bring them back to clinic, and we build on that education, and it's constantly building because of all of the advances and the changes in the world of diabetes that we're always dealing with. And then in addition to that, we take all of our education on the road and out into the community to work with school nurses and other programs like the American Diabetes Association to show not only these kids but the families as well that we're not only an advocate for them in the hospital but outside in the community as well.
So Addison was diagnosed with type 1 diabetes fall of 2016. She just started kindergarten, and we just started noticing some signs and symptoms, but the signs and symptoms of type 1, they were justifiable. And then it was Halloween, and we had walked the neighborhood, and she was painfully thirsty afterwards. And I just told Josh, I said,
she had a hunch that something, was up. I remember she brought home the glucometer. They decided to test it one morning when she woke up real early. And of course, we told Addison the night before that we were going to do that. So, bubbly Addison wakes up at 5:30 that morning. Hey, Mom, let's check my blood sugar for you. So came back, and I think it was 380 or
342.
Yeah, 342.
Number will stick with me forever.
So that's kind of when we just kind of looked at each other and like, okay, let's go. I think for me, what sets ACH apart from other clinical settings is just the fact, we feel like we're part of a family here. The level of training and education that they provided. I was clueless to this whole, diabetes world.
They're always there for other people, and they make everybody feel very safe, and that's why they're a family to me.
We're thankful, very thankful.
Oh yeah, absolutely.
For everything.
Several years ago, Safe's hairdresser noticed some signs on the back of his neck and thought, this might be associated with diabetes. You should go ahead and get this checked. Me being a physician, I sort of was in tune to it and had bought a glucometer, and we were checking his blood sugars regularly. And so 2 Christmases ago, I noticed that his blood sugars were going up. And we sought attention at Arkansas Children's Hospital, and they got us in pretty quickly, and we checked, and the diagnosis was made in January of 2019. The diabetic journey has been extremely challenging. To be diagnosed at any age, I think, is challenging. To be diagnosed as a kid or as a teenager is, I think, extra challenging for any parent. It's very life-changing. But Dr. Toss and his team have been available for us essentially 24/7.
Yeah, he's been a great doctor so far. He's helped me a lot. He encouraged me, and I felt better about myself.
That support, you can't put a dollar amount to that support.
I think The impact has been very positive. Patients have been able to live their normal life. They are able to get the latest technologies in diabetes and able to, go about their life as if nothing much has happened. And our practice has grown in the last few years. The number of patients have increased. We've been able to get them into our clinics sooner, and all that has had a positive effect on all our patients.
A great example is Mr. Elijah is such a sweetheart. He came in extraordinarily sick, and he was so young. He was just a little baby, and he has done extraordinarily well, even though a year later, after fighting diabetes, beating diabetes, doing a fantastic job, he comes back in the hospital with leukemia. Once again, the team did a great job. Mom did a great job. I think that's one of the things that we really excel at is when I say team, I'm not just talking about our team. We work as a team with the families, with the parents, with the patients. This kid is thriving. Elijah is a happy, thriving little guy.
The future of our program, I think, is very, very bright. So I think we have the platform to build on a very, very robust and international group to make some significant changes in our community.